Today I'm here at the Solutions Forum, which is focusing on healthcare access and affordability. Organizations like ABCD are connected to the people. They're embedded in the communities, and so having such a strong connection is really important in terms of taking information from the grass tops and relaying it down to the grassroots.
There are a lot of unanswered questions, but I hope one of the answers is that we have made a tremendous start to provide health care to all.
The government now gets all of the healthcare spending information from everybody in the state and puts it all together and studies it and publishes reports and so on, so we can see who's spending more, who's spending less, who's charging more, who's charging less.
The state and the ACA also have created these new tools by changing the way we pay for health care, with the hope that we'll have new delivery systems that focus on keeping people healthy in the long run. It was a great example of both sort of asking the big questions, but also then bringing that really down to the ground in Massachusetts, and with the leading experts and leading practitioners who can talk about what's working, what the challenges are, and how we could do things better.
ACA is actually a lot more than an IT implementation. It's a comprehensive law that brings in a whole host of benefits to the state. It really is a lot of benefit, and I think we shouldn't lose sight of that.
Once we can stop worrying about whether somebody's eligibility for a particular program is going to end on some state specific, then we can start focusing on the longer term pieces of it. Events like this call attention to the huge changes that are underway in the marketplace in Massachusetts, and I think those do create opportunities for ABCD clients to benefit from the transformation that's happening more generally.
Would it ever be part of the role of a health plan to advocate for something that it's not the fault of the people there, but they're certainly going to suffer for it?
I think that as we begin to broaden our definition of what constitutes healthcare, that's going to become an important advocacy role for plans.
The reason that we were so critical was because nobody else was. In a lot of other states where they ran into problems, there were government entities that took up the mantle of accountability and making sure that they could understand what went wrong. So that could have been a state auditor, could have been a federal agency, could have been a legislative committee looking into these issues. And unfortunately, nobody here in Massachusetts did that.
Countries that allocate their resources to favor social service spending perform better on these big population health outcomes than countries that prioritize healthcare spending, which again should seem familiar, because to me that's just a reflection of the stat I gave you about 60% of health being created by social, behavioral, and environmental factors.
It appears that if you spend a tremendous amount on health care, but don't spend a commensurate amount on the sort of social services that create the foundation for good health, then what you have is a wasted opportunity.
This is clearly a set of beginnings in this conversation. We would like to invite you to be part of continued conversations.